So this is my bone video regarding the axial skeleton. So first is the cranial bones. So it's the frontal bone here on the forehead area, the parietal bones, there's one on each side, and the occipital bone, which is here in the back. External occipital protuberance, that is the notch here in the back. It says, what is this for? The notch in the back of the head, it anchors many neck and back muscles, as well as ligaments, including the nuchal ligament and trapezius muscle. Temporal, so the temporal mandibular joint, also known as TMJ, is this joint here. The mastoid process is here just below the ear area. The styloid process, we can't really see here, it's more internally, but it's a needle-like structure inside. The external acoustic meatus is here, which is basically the outer ear. Squamous part, that's here above and around the ear area. Internal view. Petrous part of temporal bone. What structures are housed within this part of the temporal bone? The middle and inner ear cavities, which contain sensory receptors for hearing and balance. And then the sphenoid, that's kind of this area here. And it says, superior orbital fissure, what passes through this opening? It allows cranial nerves 3, 4, and 6 that control eye movement to enter the orbit. And it says, okay, internal view, the lesser wing, that's inside the eye socket. The greater wing is outside of the eye socket. The optic canal, what passes through this opening? The optic canal is in this area, and it allows optic nerves, which is cranial nerve 2, to pass to the eyes. And the sella turcica, what structure sits in this fossa? That's internally, and that is the pituitary gland that sits in that fossa. And then we have the ethmoid bone. And internal view, the crista galli. What does this do? That is the dura mater of the brain attaches to the crista galli and helps secure the brain in the cranial cavity. And then cribriform plate, what passes through the holes? Filaments of the olfactory nerves pass from the smell receptors into the nasal cavity into the brain. And then the sutures, we have the coronal suture that goes across this way, the sagittal suture, which goes vertically this way, and the coronal suture, you want to know also what bones are making up the sutures while I'm pointing them out. For the coronal suture, that's this one here, the bones are the frontal and the parietal bones. And then for the sagittal suture, the parietal bones meet the cranial midline. It's here. The lambdoid suture, which is this here, is the parietal bones meet the occipital bone. So the parietal bones and the occipital bone. And the squamous suture, which is here on the side, the parietal and temporal bones meet on the lateral aspect of the skull, so up in this area. And then we go to the facial bones, the maxilla and alveolar process. So the maxilla is the top of the face here, right here, and the alveolar process is the sockets that hold the teeth in. Nasal bone here. The zygomatic, that's these bones here, basically your cheekbones. What two bones form the zygomatic arch? The zygomatic process of the temporal bone and the zygomatic bone, the zygomatic process of the temporal bone and the temporal bone. Ethmoid, that is the bone here. Vomer, that is this bony bone here. What two bones form the bony nasal septum? The ethmoid and the vomer. Inferior nasal concha. What does this bone do? It acts as a turbinate. As air passes through it, it turns the air to receive warmth, moisture, and cleansing. The mandible is this lower jawbone. The body is here. The angle is the back. And the ramus is actually these two parts here, one on each side. The mandibular condyle is right up here. The mandibular notch is right here. And the coronoid process is right up here, but before that notch. And then we go to the vertebral column. It says, point out the four curves of the adult vertebral column. Which two are primary? Which two are secondary? So we have the cervical, which are the first 7. We have thoracic, which are the next 12. And then we have sacral, which are the next 5. So the two that are primary are the thoracic and the sacral, and the two that are secondary are cervical and thoracic. Okay, and then we go to cervical vertebrae. State how many. There's 7 cervical vertebrae. The atlas, which is the very, very first cervical vertebrae. What does this bone articulate with from the superior aspect? And demonstrate the motion on yourself what this joint allows. So the bone that it articulates with from the superior is the condyles on the underside here of the occipital bone. And the motion that it allows us to make is like if we're nodding yes. And it says, what is unique about the transverse process of all cervical vertebrae compared to those of thoracic and lumbar vertebrae? Each process contains a transverse foramen through which the vertebral arteries pass to service the brain, which is very important. Thoracic vertebrae, state how many. That's here in the middle. There's 12 of those. Point out the following. The spinous process, those are these points here. The transverse process, those are those points laterally here. Intervertebral foramen, what passes through these foramina? The spinal nerves. We can't really see those here. They're the notches that are inside, and all of the nerves pass through there. The body or centrum. The body, we also can't see too much here, but it's just inside. And position of the intervertebral discs is in between the bodies of the vertebrae. Lumbar vertebrae, state how many. There's 5. And the sacrum, how many vertebrae fused to form this bone? The sacrum's here, and that was 5 that fused. And then the coccyx, which we normally know as the tailbone, that's this here. And then we will turn him around. And the ribs. It says, point out the vertebrosternal, the true ribs. So those are ribs 1 through 7. 1, 2, 3, 4, 5, 6, 7. And the false ribs are 8 through 10. So that's 7, 8, 9, 10. Oh, sorry. 8, 9, 10. And those are vertebral chondral ribs. And the floating ribs, there's 2 of those. These are the ones here that are not attached anteriorly. Point out the head, neck, and tubercle, of a rib and explain how ribs articulate with the vertebrae. This is the head, which is attached to the vertebrae. So that's the head. The neck is this area here. And the tubercle, is the notch, and you can't really probably see it, but it's right here. And it says, explain how ribs articulate with the vertebrae. So all 12 ribs articulate posteriorly with the vertebrae. So all 12 of them attach here. 1 through 7 attach at the sternum. 8 through 10 attach to the costal cartilage area. And then 11 and 12 do not attach anteriorly at all. And that is it for the axial skeleton.